Welcome to this COVID-19 update for Rogers. My name is Tina Avery, and joining me today is Dr. Mercer, Chief Medical Officer of Health and CEO of the Wellington-Dufferin-Guelph Public Health. Dr. Mercer, thank you so much for taking time out of your busy schedule to meet with us today.
Thank you very much for having me.
So I think it's important, and I wanted to start off with maybe if you could give us an update on the current number of cases of COVID in Dufferin, Wellington, Guelph.
Well, the numbers continue to rise, albeit quite slowly. So it appears that we've had somewhat of a flattening of our curve. We are finding new cases each day. We still have every day we have cases that come reported in, and currently we're over 150 cases in the area, of which, interestingly enough, Dufferin does disproportionately, based on its population, have more cases than Wellington or Guelph on a population basis.
Are these numbers a lot higher, or are they potentially a lot higher due to the fact that a lot of people, I guess, are being told to stay home and monitor their symptoms before coming out to one of the treatment centers? Is it potential that it's a lot higher than what it is showing right now?
Well, anytime we monitor for diseases, we always know that the people who get tested are only just a small portion of the people with disease. What I can say, though, is that when people are isolating at home, is that people in general are actually a bit healthier right now. We've seen our influenza rates plummet. Calls to physicians' offices for coughs and colds also seem to have declined. So by people self-isolating, not only are they protecting themselves from COVID-19, they're also not getting sick from a number of other viruses as well.
And let's talk about that. The people that are actually experiencing symptoms or health issues that are not related to COVID-19, what should they do? People who maybe have an ailment or have hurt themselves, what's the best way for them to get treatment right now?
That's a really great question, actually, because our family physicians and our nurse practitioners, they're actually working. So you can actually access your own primary care provider right now on the phone. And sometimes you'll actually be asked to come into the office depending on what it is. If you have a child that needs immunizations, for example, you can probably access that in a safe manner in the physician's office. And there are some things that you just can't do over the phone. So for people who have health conditions and you're wondering if you can get help, you absolutely can. Call your family doctor and they will look after you.
Wonderful. And obviously, in case of an emergency, that's when they call 911. We want to make sure that people are taken.
Yeah, absolutely. Yeah.
So with the projected numbers, I guess that the government's been giving us, the province, do you feel, this is kind of a related, it's a very fluid situation, but do we feel that we've reached the peak of COVID-19?
Well, usually when we say we've reached the peak, we always do that looking backwards, and then that's when we know we have reached the peak and have gone past it. So it's a little bit of a retrospective look. Teresa Tam, the Chief Medical Officer of Health for the country of Canada, did seem to indicate that there's been a definite flattening of the curve, and I strongly want to congratulate people for social distancing. It's actually made a real difference. We are not in Italy. We are doing quite well. Please keep up the good work, because it looks like our numbers are starting to stabilize.
And I think it's really important, too, that we point out this doesn't mean there's a lapse in the physical distancing. This doesn't mean that we should stop doing what we're doing. We don't want to go out there and cause another spike right now.
Oh, absolutely. And yeah, absolutely. Like, it is working. All the measures that we are doing are working. It does take a little while for people to incubate. So anything that people may have caught takes on average about 5 days, sometimes a bit longer, sometimes a bit less. So we're always doing a little bit of catch up when it comes to disease finding because of that.
And where is the best place for people to gather information? We are being overwhelmed in social media, on the news and the radio, with a lot of information, some of it being very accurate, some of it questionable. So where's the best place for people, the residents of Dufferin County, Wellington, and Guelph, to get the best information on them, or the most up-to-date current information?
Yeah, well, I'm going to suggest two websites that are really good, but the first is ours, Wellington-Dufferin-Guelph, publichealth.ca, wdgpublichealth.ca. And if you Google Dufferin Public Health, you'll get to our website. Well, as soon as you get to our website, on the opening page, there's 2 buttons. If you're a healthcare provider or if you're a regular citizen, just choose the button that applies to you. And on our site, we carried links to every website, every document. It's a good place to start, and it should give you all the credible information you need. Second place, if you want to go and look for and read more scientific documents, is Public Health Ontario. And Public Health Ontario has many documents there and many reviews on best practices for you to read.
So there's been some conflicting stories online and in the news with regards to the use of masks or non-medical masks. Is this something that we should all now be wearing as a non-medical mask when we're going out?
Yeah, you're right. And we certainly have seen and read all kinds of conflicting stories on that. And it's often appeared that the message has changed slightly over the last few weeks, which does make it confusing. I think the important thing here is there's 2 points I want to make. Is first of all, for people who are non-medical people, we're really talking about cloth masks. We're not talking about surgical masks. I really want to encourage our listeners to leave the medical grade surgical masks to the healthcare providers because we don't have enough. And so if you're using their supply, then they may run out. So we're not talking about that. We're talking about cloth masks, homemade masks. And there is evidence that they do work, but they don't work necessarily in the way people think that they work. People wear them thinking that they're being protected, and actually they may be protecting others from them. So if people have symptoms or in an early, what we call a pre-symptomatic phase where they may be shedding, wearing a cloth face mask may decrease their shedding into the environment. It is important to recognize, though, that social distancing or physical distancing is very important as well. A mask doesn't protect you, and some people get this false sense of security. I'm wearing a mask, I can get close to people. No, we really want to encourage people to continue to have physical distancing. It is probably helpful, though, if you can't avoid physical distancing, and sometimes you're getting on an elevator or you're getting into a streetcar or bus, perhaps those are better environments. But above all, it is meant to protect others from you. You protect yourself by staying home, and if you do have to go out, physical distancing.
Absolutely. So for those people that are wearing the non-medical masks, maybe you could give us some pointers or some tips on the proper way to do so, and the proper care, because once you've worn it, it technically, I guess, becomes contaminated. Is that correct?
I think it depends on how long you've had it on for and in what environment that you're wearing them. So the typical person might put it on to run into a grocery store or pharmacy, and so for a short period of time. We absolutely recommend that the masks are washed frequently, and it depends on how much you're wearing it, though, and how often that is. But yes, please wash them frequently. How should they fit? Well, it is important that they fit around the face as best as you can. There's different actual patterns out there on the internet. So some faces might need one pattern and some faces might need another. So find the one that works for you, that's comfortable and that provides a reasonable fit around your face. Be really careful when you're wearing one to not adjust it. Anytime you reach up your hands and adjust your mask or move it, you run the risk of taking your hands, which may have COVID-19 on them, and contaminating your face. And we know that's a really important thing, is to not do that. If you want to take it off after you've worn it, the most important thing is to remember is to not contaminate your face as you're doing so. So I usually recommend, if people have an opportunity, to either use hand sanitizer or wash their hands, reach behind and touch the pieces that go around behind the ears. So you're actually removing the mask from your ears, knowing that the front part of the mask may actually be contaminated. So try not to touch that. Take it off from your ears and take it down this way. And then always wash your hands after you've taken it off.
Absolutely. Washing your hands is critically important through this entire process, as everybody has been stressing, and we've all seen.
Yeah.
If somebody actually starts to feel some of the symptoms that are related to COVID-19, where can they find the self-assessment tool, or what should they do?
Yeah, well, you can find it on our website. We have a link to that. So if you manage to get to wdgpublichealth.ca's website, that will take you to the link. Ministry of Health also has, if you just Google assessment tool, COVID assessment tool, any of those will come up. And that will help provide that answer for you. If you have symptoms, mild symptoms, you could also call your family doctor, and they will do a telephone assessment with you, and they may actually send you to the assessment center for a swab.
Wonderful. So let's talk about, we're all trying to limit the amount of times we're going out to once a week to get the groceries or pertinent things that we do need, medication, that sort of thing. Let's talk about the food products. Should we be wiping down and disinfecting all of the boxes and cans and everything that we're picking up from the stores when we get home from doing the groceries?
That's a good question, and I think it's also a fairly low risk activity. First of all, we do know that virus can only grow or stays alive on a cardboard for up to 24 hours. And the way the virus is, so I want to make sure your listeners understand that this virus is a piece of an organism. It's actually not a whole organism. It's not like a bacteria, which is a complete whole unit. This is a piece of RNA in this case. This piece of RNA can't grow outside of a human host. So it just sits there for a while and dies. So it's not multiplying. So if there is RNA left on a surface, over time it will die just in and of itself. And we know that on cardboard it's up to 24 hours. And it's not linear. It means that at the 12-hour mark, half of it's gone and half of it's still there. It doesn't work like that. The majority of the virus dies very quickly in the first part of the cycle. So all of the products that you are picking up, they're still very, very low risk. If you have, and you're concerned out of an abundance of caution, you could certainly leave them untouched for 24 hours, but really, honestly, it's a very low risk thing. And the fruits and vegetables that you are handling and bringing in, just wash them like you normally would. You don't have to use soap. In fact, sometimes soap leaves contaminants and residue on some surfaces. I went, broccoli or lettuce. So just use water and wash them as you normally would.
Great. I mean, I think that that's wonderful clarification on if the virus can, it's a source of root of, spreading the virus. And I think that's a lot of things that people are concerned about. I've read stories where people are washing their fruits and vegetables with soap and possibly getting sick from that. So we definitely want to avoid doing that if possible. And I think it was a great suggestion that you made that if you don't need to use the boxes or cans or anything that you've purchased, then put them in your cupboard for 24 hours and then use them after that. So I think that's absolutely wonderful. So I know that you're incredibly busy with everything that you're doing, but I've been asking all of my guests this question. What have you been doing to kind of keep sane? Because obviously this COVID-19 crisis has kind of upped the amount of time I'm sure you're spending working. So what are you doing to kind of keep joyful and positive and spend some of your off time?
That's a great question. I don't have quite as much off time as I used to have. So you're right, I am working a lot of hours. And for me, I practice yoga and meditation. So I can still get yoga online, and I still have an ability to continue to do my yoga, even if it's not in the same place or time that I used to do it. So I encourage your listeners to try to find something that works for them, that they enjoy.
So when we're talking about the people that work for public health, how has it affected how you're doing your job daily? Obviously, you're joining us from home today, as I'm here in my home. But what have been the challenges for you?
Yeah, well, certainly we have redeployed staff into jobs that they don't normally do. So the willingness and the support of the public health staff has been just fantastic, as they've all had to learn to do something different, often in a different location. You are correct. I'm home today. I'm trying to spend 1 or 2 days a week working from home. Most of my staff, I shouldn't say most, but quite a few of my staff are also working from home, some of them permanently, some of them intermittently. And the ones that are still working at the actual building, we've spread them out. So they're no longer in close proximity, sometimes to their colleagues and the people that they've worked beside for years. Everybody's spread out. So that's a bit of a difference for them. And certainly every corner of our building now is sort of utilized for spreading people out for social distancing or physical distancing while we work. So there's been some positives as well too. I think that we've all learned different things about ourselves as we've had to learn how to do different skills and do things differently. And it's an interesting time in public health.
Absolutely. Well, Dr. Mercer, I want to thank you so much for taking time out of your busy schedule to speak with all of our viewers today. And we hope that you are also staying safe and healthy. And thanks again for taking the time.
Thanks for having me. Talk to you again.